Hello friends, I hope all of you are doing well and good. I welcome you on my YouTube channel Basel Insurance Guide. So first of all, I request you to kindly subscribe my YouTube channel and press the bell icon button to get latest new uploaded videos on my channel directed to you. So let's start my today video on my YouTube channel Basel Insurance Guide. My today video is going to about Health Insurance Portability and Accountability Act HIPAA. So let's have detailed review on Health Insurance Portability and Accountability Act called HIPAA. So the Health Insurance Portability and Accountability Act of 1996 HIPAA is a federal law that required the creation of national standards to protect sensitive patient health information from being disclosed without the parent's consent of knowledge. The US Department of Health and Human Services issued the HIPAA privacy rule to implement the requirements of HIPAA. The HIPAA security rule protects a subset of information covered by the privacy rule. HIPAA privacy rule. The privacy rule standards address the use and disclosure of individuals' health information known as protected health information or PHI by entities subject to the privacy rule. These individuals and organizations are called covered entities. The privacy rule also contains standards for individuals' rights to understand and control how their health information is used. A major goal of the privacy rule is to make sure that individuals' health information is properly protected while allowing the flow of health information needed to provide and promote high quality healthcare and to protect the public's health and well-being. The privacy rule permits important uses of information while protecting the privacy of people who seek care and healing. So, covered entities, the following types of individuals and organizations are subject to the privacy rule and considered covered entities. So, healthcare providers, every healthcare provider, regardless of size of practice, who electronically transmits health information in connection with certain transactions. These transactions include claims, benefit eligibility, required inquiries, referral authorization requests, other transactions for which HHS has established standards under the HIPAA transactions rule. So health plans include health, dental, vision, and prescription drug insurers, and health and maintenance organizations, medical, Medicare, Medicaid, Medicaid plus choice, and Medicare supplement insurers, long-term care insurers excluding nursing home fixed indemnity policies, and employer-sponsored group health plans, and covered and government and church sponsored health plans, and multi-employer health plans. So exception are group health plan with fewer with than 50 participants that is administered solely by the employer that established and maintains the plan is not a covered entity. Healthcare clearing houses, entities that process non-standard information they receive from another entity into a standard like standard format or data content, or vice versa. In most instances, healthcare clearing house will receive individually identifiable health information only when they are providing these processing services to a health plan or healthcare provider as a business associate. So, business associate, a person or organization other than a member of a covered entity's workforce, using or disclosing individually identifiable health information to perform or provide functions, activities, or services for a covered entity. These functions, activities, or services include claims processing, data analysis, utilization review, and billing. Permitted uses and disclosures. The law permits but does not require a covered entity to use and disclose PHI without an individual's authorization for following purposes or situations. Disclosure to the individual if the information is required for access or accounting of disclosures The entity must disclose to the individual treatment, payment, and healthcare operations, opportunity to agree or object to the disclosure of PHI, and incident to an otherwise permitted use and disclosure, limited data set of research, public health and healthcare operations, public interest and benefit activities. The privacy rule permits use and disclosure of PHI without an individual's authorization or permission for 12 national priority purposes. And number one is when required by law, number two is public health activities, and number three is victims of abuse or neglect or domestic violence, and number four is health oversight activities, and number five is judicial and administrative proceedings, and number six is law enforcement, number seven is functions concerning deceased persons, and number eight is cadaveric organ eye or tissue donation, and number 9 is research under certain conditions, and number 10 is to prevent or lessen a serious threat to health or safety, and number 11 is essential government functions, and number 12 is workers compensation. So HIPAA security rule. While the HIPAA privacy rule safeguards PHI, the security rule protects a subset of information covered by the privacy rule. This subset is all individually identifiable health information a covered entity creates, receives, maintains, or transmits in an electronic form. This information is called electronic protected health information. To comply with the HIPAA security rule, all covered entities must ensure the confidentiality, integrity, and availability of all ePHI. Detect and safeguard against anticipated threats to the security of information. Certify compliance by their workforce. So, covered entities should rely on professional ethics and best judgment when considering requests for these permissive uses and disclosures. So, the HHS Office for Civil Rights enforces the HIPAA rules, and all complaints should be reported to that office. HIPAA violations may result in civil, monetary, or criminal penalties. So friends, this was my today video on my YouTube channel Basel Insurance Guide, which is about to Health Insurance Portability and Accountability Act HIPAA. So I hope all of you now have a valid good idea about HIPAA. So I request you to please like, comment and share this video, and also don't forget to subscribe my YouTube channel Basel Insurance Guide. So friends, we will meet soon in my next video on my channel. So till then, kindly take care and have good day.